Log on now at 1100kfnx.com.
Welcome to Healthy House Call, America's longest-running live wellness talk radio show, broadcasting live from Healthy Habit Health Food Store right here in Phoenix, Arizona. We feature the latest breakthroughs in the world of integrative medicine and wellness. Here, world-class physicians, medical researchers, authors, leading politicians, Hollywood celebrities, professional athletes, and more importantly, testimonials from consumers and patients. To weigh in on the conversation, give us a call at 602-266-1000. And now, here's your host, Dan Kuntz.
Thank you, Michael. We certainly appreciate that, and welcome to Healthy House Call. Certainly a pleasure to have you with us today, and as usual, there's never a dull moment in live radio. I can tell you what, we are wired for sound in a big way. We've got Dr. Chris Salvino with us for the first part of the program, and then, of course, Dr. Tony O'Donnell will be coming on very shortly right after that. But we've got an amazing interview this morning with Dr. Chris Salvino, who is a traumatic surgeon at Good Samaritan Hospital, and it's a pleasure to have you with us today, Dr. Salvino. We appreciate it so much.
Well, thanks for having me on, Dan. It's been a pleasure to be here.
You know, a lot of folks need to understand that you are running. You're a candidate for the U.S. Congress, the 2010 District 5, right here in Arizona. And we need doctors in office like yourself that understand all about the reason why we need health reform. Let's talk about that for just a moment, because we know the Obama health plan is riddled with all kinds of compromises and lots of things that are that the Americans don't even know about yet. Let's take it from there. Let's talk about what can we do with the health reform, Dr. Salvino. This is very important. We get down to the bottom of this.
Well, Dan, you don't like the 2,400 pages of new entitlement, bigger government? Come on.
Man, I'll tell you, it's incredible. I mean, I get dizzy just thinking about all that volume of information there.
Let's talk about how it's going to be paid for, though. That's the big one. People ask me that question every day.
You know, it's incredible. We know our taxes are going to go through the ceiling. In Germany, they take 60% right off the top, without any consideration for deductions. And in Canada, they've been taking 40% for years. And, of course, the people up there have adjusted to it. Americans, we're spoiled because we have not been paying very much in taxes relative to what other countries are that have the type of plan that President Obama has implemented and thrust upon us is going to be requiring probably about 60% of our income right off the top with no deductions. No one's even talked about that, have they?
No, in fact, if you really look at it, not only the things you've talked about, but $500 billion, not $500 million, $500 billion is going to come from Medicare at a time when Medicare is bankrupt in 2017, more taxes, and more entitlement programs onto the states when they can't afford it. I mean, Arizona's essentially bankrupt, so those three things are just going to kill us financially.
So I guess pretty much the bottom line is, what is the solution to all this mess that we're facing right now with given the Obama health plan that no one has really any idea what really is involved with the full ramifications?
Sure. The main problem in healthcare, which the Obama plan missed, is cost, C-O-S-T. I wrote a 7-page plan that we've got up on our website on how to reduce the cost of healthcare without touching Medicare, without adding taxes, without adding unfunded mandates in our states. And it makes the system cleaner and simpler to operate, and it's 7 pages, not 2,400.
Well, I'll tell you what, we do need simplicity in government, and I appreciate the refreshing approach that you brought to the table here, Dr. Salvino. And for those people that would like to understand more about your website and your proposals, where can they go?
They can go to www.drchisforcongress.com. It's interactive. You can blog, take polls, read articles, do all sorts of fun things on that website.
Excellent. Very, very important. Most people out there that are listening to this broadcast are very familiar with us talking about nutritional support, wellness, anti-aging, and lots of great things relative to the overall health, but we normally don't talk about politics. And, of course, I think that's probably refreshing in many ways, but we have to get involved. We have to get our voters informed as to what's really going on. This Financial Reform Act, the Food Safety Act that has been thrust upon us, I'm not even sure what the status on that is, but that's a can of worms, and we'll get an update on that later in a future broadcast. I want to make sure we give you our live call-in number, 602-266-1000. Guess who's standing by? Claudia is standing by to take your calls. Call us right now, and you can speak with Dr. Chris Salvino for just a quick minute. If you have any questions, if you want to find out what's really going on in Congress, talk with Dr. Chris Salvino right now. You can also go to his email, and that email address is?
It's CHRIS at drchrisforcongress.com.
Very important. And you will take time to answer letters and emails that come in from our listeners?
Especially off our website. If you like my healthcare plan or don't like it, we still respond back. So if you want to go there and blog, we respond almost nightly.
Excellent. We really appreciate that. Let me ask you this, Dr. Salvino. For those people that are concerned about the Obama health care plan, you've got a seven-page proposal to actually implement changes. What is the likelihood of implementing your changes into the present Obama health plan?
Great question. Whether the Obama plan passed or not, we have to implement these changes. So whether it passed or not, it's really important to get into medical malpractice reform, insurance reform, and electronic reform. So take a look at our plan. There's 5 steps in there. It's not rocket science. It's designed for the American people to see where the parasitic, wasted costs are in the healthcare system.
The parasitic waste. Oh, man, I like that. The most insidious of all parasites, Trichinella spiralis. So many people out there are listening right now that want to ask questions. If you would like to call in and speak with Dr. Salvino, call us at 602-266-1000, and we'll be most happy to speak with you. Dr. Salvino is with us right now. We have Dr. Tony O'Donnell coming up in just a moment. He'll be with us very quickly. But Dr. Salvino, of all the things, we've got a couple of pages of questions we were going to cover in our interview this morning. What would you say is the most important thing for us to kind of give a bottom line to our listeners right now?
We are, as a group, as a country, faced with the American nightmare. We need to get back on track. Healthcare is a part of it. The plan we outline on our website is the first step in the healthcare revival. So we do need healthcare reform. There's no doubt about it. It's a question of what kind of reform. Do you want bigger government, more government that doesn't really address the problem? Do you want smaller government and strategically cut out with surgical precision the parasitic cost in healthcare?
Well, I really like that. And, the Americans we're basically spoiled when it comes to federal taxes. I know that what's around the corner is more and more federal taxes. People are going to be mandated to get their checks at the bank. In other words, direct deposit. They won't even see their checks, and the money will be taken right off the top, 60% or more, as they do in Germany and Romania and other countries in Europe. That is going to cause considerable unrest with Americans. It won't set well. And so this is very important. Please give your website again, Dr. Salvino.
Sure, great. Thank you. It's www.drchrisforcongress.com.
Very good, Dr. Salvino. Thanks for being with us. We appreciate that. We'll have you on the show again very soon as we approach the elections to keep everybody updated, and especially for those folks that want to learn and discover the 7 pages that Dr. Salvino has proposed. It's on his website. Again, you can also email Dr. Salvino at...
It's CHRIS at DR, not doctor, sorry, DR, CHRIS, Congress.com. Very similar to the website address.
Very good, Dr. Salvino. I appreciate that, and thanks for being with us today. We appreciate that so much.
Thanks for having me on.